Right. So we're recording now. So doctors, for Mdcn exam, levels of prevention is the stations you are going to get during the Osce station. Okay, levels of preventions. So, and I always say this, you're not just going to get levels of prevention, just like what are the levels of preventions. You are going to be asked more questions about the levels of preventions. Do you understand what I mean, doctors? You are going to be asked more questions about levels of prevention. So you're going to be asked questions about levels of prevention, not just state levels of prevention. You're going to be asked some other questions about levels of prevention. Please, doctors, so let's start with levels of prevention. So you are not just going to be asked what are the levels of prevention. You'll be asked some other questions. For example, there was a time in Kano during the exam, there was questions on levels of preventions, and it was cervical cancer. So they were asked questions on cervical cancer. They didn't just ask them what are the levels of preventions. They asked some few questions on cervical cancer before asking them levels of preventions, probably the risk factors of cervical cancer, some other question in respect to that, and before you are asked the other question. So it's very important for you to know something about those topics. So there's going to be a scheme we're going to talk about. So first, the list of the thing we're going to do. We're going to discuss about the list of what we're going to do. There's some particular IE topic we're going to talk about. These are very important topics. Let's take note of it, please. Okay, these are very important topics. So what are the lists? Let me just start the list here. So under the levels of prevention, we're going to do things on Lassa fever. We're going to do Lassa fever. We're going to do meningococci, meningitis. We're going to do things like cholera. We're going to do things like white polio. We're going to talk about also yellow fever. We're going to talk about Ebola. We're going to talk about monkeypox, very important, monkeypox. We're going to talk about measles. Also, it's a very high topic ahead of the exam. We're going to talk about AIDS, HIV. Let's take note of this. AIDS, HIV. We're going to talk about TB. We're going to talk about malaria, levels of prevention. We're going to talk about COVID-19. We're going to talk about cervical cancer. Doctor, please, I want us to note this topic. Please mark this topic and save it. We've done some of it before. We're going to go through everything together again. So these are very high topics that we're going to go through all together again. So we're going to use follow the levels of prevention, and we're going to deal with each topic. Today we're going to try and do at least 2 out of these topics, and we're going to do counseling. Okay. So first, for the levels of prevention, what are the things you should notice, doctor? What are those high points you should notice for levels of prevention? First, in Nigeria, if you are asked levels of prevention in exam, if you are asked, can you state the levels of prevention? There are 5 things that is expected of you, doctors. There are 5 things they're expecting you to say. And one of the things they're expecting you to say is health promotion, specific protection, early diagnosis and treatment, limitations of disabilities, and rehabilitations. These are the 5 things they're expecting to hear from you. They are not expecting you to talk about the primary levels of prevention, secondary levels of prevention, and tertiary levels of prevention. Obviously, all these 5 things are the ones that are subdivided. There is those 3 things that are subdivided into the 5 things. So what are these things? You remember, these are what they should hear from you. This is what they want to hear from you in Nigeria if you ask the question on levels of prevention. We talk about the health promotion. Okay, then we'll talk about the specific prophylaxis. Specific prophylaxis is also known as specific protection. Okay, then the next thing is early diagnosis and treatment. And the third thing they want to hear from you is limitations of disability. And the last one is what? Rehabilitation. So all these 4 or 5 things actually still falls under the 3 major levels of prevention. Everything still falls under the primary, secondary, and tertiary levels of prevention. First, what do I mean by primary levels of prevention? What do I mean by tertiary levels of prevention? These are very important things. Everybody should know, doctors. These are very important things because each one of them fall in. Okay, let me type it here. We have the primary, secondary, and we have the tertiary levels of prevention. What do I mean by these levels of prevention? Is primary levels of preventions are levels of preventions where you try as much as possible to prevent incidents, to prevent the occurrence of any of the disease. That's what they mean by primary levels of prevention. So you try as much as possible to prevent the occurrence or for any disease to start. Why for secondary levels of preventions is more of like, okay, the disease has happened. You want to try as much as possible this disease that has happened. You want to try and find that disease and treat it. I get what I'm saying, and treat it and make everything okay. Why for tertiary levels of prevention is this person has diseases. There's nothing you can do. The basic thing is you want to prevent the person from having complications or you just want to manage the person. Example of this is somebody who has diabetes. Obviously, this person will always have diabetes. So you want to manage that diabetes. That thing will always be there. So it's mostly tertiary levels of prevention. Example of primary levels of prevention is, let's say, for example, you using let's say seatbelt, for example, seatbelt in a car. You are trying to prevent the accident from happening. So that's an example of a primary levels of prevention. You are preventing incidents to happen. I believe everybody is listening to me, doctors. Can everybody hear me?
Yeah.
All right, good. These are primary levels of prevention. So each of these 5 levels fall under this. Okay, each of these 5 levels. So the acronyms is, just remember, 2, 1, and sorry, 2, 2, 1, right? If I'm correct, is it 2, 2, 1, doctor? Or 2, 1, 2? 2, 2, 1 or 2, 1, 2? It's 2, 1, 2, right?
2, 1.
Sorry,
Yeah.
2, 1, 2.
It's 2, 2. I know.
It's 2, 2, 1.
2, 1.
Yes.
Yeah, it's 2, 2, 1, doctors. What do I mean by this? So these health promotions and specific prophylaxis are examples under primary levels of prevention. I want us to take note. Health promotions, specific prophylaxis, they are examples. Sorry, hold on, doctors, please. They are examples of hold on, please. So what do I mean by this? Hello, can everybody hear me, doctors? Hello, can everybody hear me? So for the primary levels of preventions are the promotion and specific prophylaxis. Why secondary level of preventions are early diagnosis and treatment. You understand? You want to prevent prevalence. And here is the tertiary levels of prevention, which is more of like the rehabilitation. Are you getting what I'm saying? So what are those things that is entails under the health promotion? What are those things you need to tell, you need to explain? This station is actually an oral station, so you need to explain some certain things. So what are those things you want to explain here for health promotion? For health promotion, health promotions include things like health education. So you want to educate the masses regarding to that illness. Maybe, for example, Lassa fever. You want to tell them about Lassa fever. And how do you educate them? Maybe through radios, through TV, through flyers. So you give flyers. Apart from this, you want to do maybe organize symposium or seminars, etc. So you try to educate the masses. You try to reach out to the masses and everything. So this is under health promotion. And apart from this, another thing you also do under health promotion is you want to modify the environment. You want to make the environment okay. So environmental modification, environmental modifications. And apart from environmental modifications, lifestyles, and let's say behavioral changes. So these are what you do under health promotion. Please take note. These are what you do under health promotion. And for specific prophylaxis is more of like specific protection. So this is protection, also same as specific protection. So what are those things you do here? Things like vaccination. You don't want this person to have this disease. Don't forget, they are all under primary levels of prevention. Health promotion and specific prophylaxis, both of them are under primary levels of prevention. So what do you do on specific prophylaxis? Not to allow person to have the disease by vaccination. Vaccination, or let's say you want to immunize the patient, the person, immunization. So immunization is one of the things you do if it's available. So you do vaccinations or immunization. Okay, so what you do if available. Okay, let me say if available. Take note, doctors. So these first 2 here are all primary levels of preventions. These first 2. So please, I repeat again, in exam, for your Mdcn exam, if you are asked what are the levels of prevention, don't mention primary, secondary, tertiary. Mention health promotion, specific prophylaxis, early diagnosis and treatment, limitations of disability, and rehabilitations. Take note. Okay. So apart from this, apart from just vaccination, there are other things you might probably want to use to protect the patient. So this might include what? Isolation, use of protective gears. Let's say use of protective things like face masks, things like, let's say, hand sanitizers are some of the things you might probably want to use. Wearing protective shoes, okay, etc. There are a lot of things you might want to do here. Use of these eye goggles, you might want to wear all these things. So these are what you do for specific prophylaxis. And apart from this also, apart from use of protective device, you might also want to do things like, you want to do food fortification. You want to eat a good food. Yeah, food fortification. You want to give proper food. You want to eat good food. And you avoid eating unnecessary things. Things like monkey. You know, this will cause, what's it called? Lassa, Ebola. And you still go on eating it. You avoid unnecessary food. Or avoid eating, let's say, bats, eating monkeys, etc. Things that, you know, they are not so good. So you try as much as possible to avoid them. So apart from this, apart from food fortifications. What other things are you going to use also? Is maybe you avoid bush burning. Avoid bush burning. You know, doctors, if you burn bush, what happens to the rats in the bush, doctors? Doctor, if you burn bush,
into your house.
yeah, they will come to your house. Yes, the rat is going to come to your house. They will leave where they are staying. They will come to your house. So you want to try as much as possible to avoid bush burning. So all these doctors, all these old things are under specific prophylaxis. Everything here, they're under specific prophylaxis, specific protection. Okay? So now, for early diagnosis and treatment, it involves, first, the patient presents to you. You want to probably take a history from the patient. You want to give a clinical diagnosis. You want to do some laboratory investigations, some instrumentals, some labs. Then you proceed to treatment. So this is what you do in early diagnosis. Immediately this person has this disease, you want to manage it. You understand? You want to manage it. You want to eradicate the disease immediately. That is why it's under secondary levels of preventions. Are you getting what I'm saying, doctors? Take note of this. This is very important. Okay? So what are those things we'll probably do in early diagnosis and treatment? Early diagnosis include, let's say, taking the history, proper history taking as a doctor. Okay? You want to take proper history. You want to give a clinical diagnosis. You want to diagnose the patient. Then after diagnosis, probably you want to diagnose it using the signs and symptoms. Signs and symptoms. Okay? So what you are going to do here. So after the clinical diagnosis, maybe you want to investigate. So lab investigation. And after lab investigation is your instrumental or instrumentation. Or let's say imaging also. Everything are all under instrumentation. So doctors, please take note as a rule of thumb. These are what you are going to do these are what you're going to say most cases when you are explaining these stations to the doctor or to the examiner. I want us to take notes. This is oral stations. It's very fast. It's faster than we think. It's very faster than we think. And for limitations of disability, the aim of limitation of disability is to prevent the progressions of the disabilities or of the illness. So there are a lot of things you want to do. Probably here you want to rehydrate the patient. You want to monitor urine output and all the rest. So these are what you do here in limitations of disability. For limitations of disability, the aim is to, let's say, limit progression of any disability. Okay, so what are the things we want to do here? Maybe IV rehydration. You want to do things like IV rehydration. You want to do things like, let's say, monitor urine outputs. You want to monitor the urine outputs. You want to secure a catheter, so catheterization. You understand? So these are what you do under this place. Then for the last part is rehabilitation. Okay, what do you do under rehabilitations or rehabilitation? So rehabilitation is you want to actually rehabilitate the patient medically. You want to reinstate the patient back to the environment. So this will include things like social rehabilitation, vocational rehabilitation, and so on and so forth. So you want to bring the patient, maybe somebody who had, let's say, COVID-19, or for example, there might be a lot of social stigmatization. You want to rehabilitate this patient. You want to counsel this patient. You want to integrate the patient to the family again, to the environment, to the work that the patient is working. These are very important points we need to take note of. Do you understand, doctors? So what are those things under rehabilitation could include? Let's say things like vocational rehabilitations, things like, let's say, social rehabilitations, things like psychological rehabilitation, medical rehabilitation, and so on and so forth. So this is what you're going to do under rehabilitations. Please, doctor, I want us to take note of this. Any question regarding levels of preventions like this whole thing here? And doctors? Any question regarding that? Okay, good. So doctors, this is the rule. The rule is if in exam you get to stations on levels of prevention, as I said earlier, they are not just going to ask you what are the levels of prevention. That will be just a sub questions under the stations, under every station. This is just going to be a sub question. There are going to be a lot of questions that you'll be asked. This question of what are the 5 levels of prevention. They might not even use 5. What are the levels of prevention? So you tell the examiner, we have the health promotion, specific prophylaxis, early diagnosis, limitation of disability and rehabilitation. Then you'll be asked, can you apply these 5 levels of preventions to Lassa fever, for example, or to meningococcal meningitis, or to COVID-19? So you have to know all this. Once you have idea of all this, it will be easier for you to apply the all levels of preventions to it. Does that make sense, doctors?
Yes.
All right, good. So don't forget, each of them, we divided it already to 221. The first 2 are primary levels of prevention, where you are trying to prevent the incidence or the occurrence of the illness. While the next 2 is secondary levels of prevention. This person has gotten the disease, you are treating it immediately, you are eradicating it. The tertiary levels of prevention, this person will always have it. You want to try as much as possible to manage the whole progression. You understand what I mean, doctors? That is for the tertiary levels of preventions. So very important. There are things that I want us to take note when we are discussing levels of prevention. So for each of our classes, what we are going to be doing is, these are the things I've said it before. There's a scheme we are going to follow. So for each of these, you can learn it on your own, or you can pick up any case or anything and learn it on your own. And some of the things you are going to be doing is, number one is you need to know the definition. It's very important. Definition. So maybe you are giving, maybe you are given a case, for example. You need to be able to define what is Lassa fever or what is cholera. Then after the definition, you need to know the causes. This is the scheme we are going to be following for any levels of prevention. You need to know the causes of that levels of prevention. These are very important. Please, doctor, take note. You need to know the causes. Apart from the causes, you need to know the main affected group. Probably the age group that are always affected or that are predisposed to having this hemorrhagic illness or any of them. Please take note. And apart from that, you also need to know the focus of infection. Focus of infection. For example, maybe Ebola fever, which area in the world or which continent is affected, which geographical location is affected. So you need to know the focus of infection. And apart from knowing the focus of infection, you need to know the mode of transmission. Mode of transmission. This is very important. And apart from mode of transmission, you also need to know the incubation period. Doctors, I always say this. There was one of the exams. One of a colleague was saying in MCQ actually, they asked a lot of questions on incubation period. So you should know incubation period. In previous exam, there was a question on an incubation period regarding what's it called? I think rabies, when they said somebody was bitten by a dog and the person was isolated like for how long, just to know the incubation period. There was an MCQ question like that. So it's very important, incubation period. We should all know for each of the illness. And apart from the incubation period also, the signs and symptoms are very important. Signs and symptoms. And apart from signs and symptoms, is the next one is diagnosis. So how do you want to come to a diagnosis? You want to diagnose this illness, you want to do your lab investigations, you want to take your history and everything. That is on diagnosis. Then the last thing is treatment. So for treatment, it's where you now use your levels of prevention. You understand? So for each of these things here, doctors, Lassa, meningococcal meningitis, cholera, white polio, yellow fever, Ebola, monkeypox, you should be able to apply all this to it. You should be able to know the causes or the etiology, the causes or let's say risk factors. You can put / risk factors. You understand? Risk factors, sorry. Causes / risk factors. Then the main affected group. So you should know each one, at least one for each of them, and you should be able to apply them to this thing here. Please, I believe everybody understand. Any question regarding this whole thing before we start, at least maybe Lassa or meningococcal, we'll do two today. We have to finish everything. You understand, doctor? So any question regarding that before we continue? Any question?
No.
What we've explained? Doctors? Is Dr. Shea here?
No.
Is Dr. Shea here? Oh, Dr. Shea is here. All right. Okay, no problem, doctors. So I think this thing is probably going to, please, if you are making